I truly believe that toxins are the greatest threat to our physiology. They really know how to hide in our body. They hide in our visceral fat, and it's very hard sometimes to get these things out.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today? Oh, oops, Raja is not here today. It's just me. I'm flying solo. This is such a privilege for me. Finally, Raja is going to get to complete his childhood dream. He can't be here because he wants to be a car mechanic, so he's getting training on that. But more seriously, we will see him in the next episode. And we have a wonderful guest here with us today. And I wanted to introduce to you folks Dr. Valerie Gershenhorn. Valerie is a really qualified clinician. She not only did a full residency in internal medicine and was a chief resident, she then decided to go do a dermatology residency and then also got some training in integrative medicine. For example, she completed the famous Andrew Weil program, as well as some other training. So we wanted to talk to her because she seemed super uber qualified to talk to us about various topics that have to do with dermatology and integrative approaches to dermatology. So, hey, Valerie, welcome to the program.
Thank you so much. I'm really excited to be here.
Absolutely. And why don't we start in the beginning, because you have really a very interesting full CV. Can you tell us how you kind of pick and choose the training, how things happen? Was it your control or life kind of happened and choices kind of came your way? Was it all planned in advance? How did you end up in the path that you did?
So it wasn't anything that I had planned. It just happened the way I think it was meant to. I grew up in a family of physicians, my parents and my aunt that I was closest with. And I always knew that I wanted to be in service of people in a position of healing. I just didn't know it would look quite like this. I went to work with my parents often. And so I loved the passion with which they lived their dreams out. And when I was 12 years old, my mom was diagnosed with breast cancer and she was only 35. And so I watched her for 10 years really fight courageously. And unfortunately, at that 10-year mark, she really couldn't fight any harder. And right before that happened, I started to really explore integrative health. And I started to read anecdotal reports of people who were healing from cancer. And I really wanted to help her, but at that time it was too late. And I was just about to enter medical school. And I realized that I just needed to understand like root cause health. And it took me many years to even understand that the body is truly integrated. It's all connected. So I really loved medicine in general. And I just did an internal medicine residency because I wanted to learn everything about the human body. And then I slowly realized that dermatology was my passion. I had suffered for years with acne and had been on all the conventional treatments. And I wanted to really explore that. And I felt that I couldn't have done it in a better fashion because I really felt that internal medicine training allowed me to not compartmentalize the skin and other body parts, but yet to integrate them. So I did feel a lot of times I was still searching for mentors that really thought the same way that I did. But in my own time, in my own way, I really learned and I healed my own acne this way. And it's really my passion to be able to integrate conventional medicine as well as the more integrative medicine. And that's what led me to explore Dr. Andrew Weil's program in integrative medicine. And then finally, and most recently, Dr. Julie Greenberg, who did a root cause dermatology course for 4 months that I completed in the summer. So it really was exactly the path that I was meant to fulfill. I just never imagined it would look this way.
Right. Yeah. And I think life tends to happen like that. It sounds like great training. And certainly Dr. Weil was a keynote speaker, and Julie, we all love, and the speaker and part of our programs at Learn Skin many times. And really, I feel at home talking to you. So thank you. I wanted to ask you, because you mentioned doing the internal medicine residency as a way for you to become a more holistic clinician, which I think is very interesting. You know, we hear a lot of criticism about current modern medicine. Allopathic medicine is sort of the ill to the pill kind of approach. By the way, not just within internal medicine, also the other subspecialties for sure. But I like your idea of saying, no, 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 I learned all this to kind of really go more holistically after that. Can you comment on that? How you really find the holistic part of internal medicine rather than the kind of break it down to a problem, I'll fix it, a problem, I'll fix it?
Yes, and I have tremendous respect for the conventional medicine because if, God forbid, somebody has a trauma or an accident, of course, this is where we need the trauma centers and the surgeons. And I believe in that 100%. I mean, there are life saving medications and surgical procedures, but I feel that what's happened, unfortunately, is we're looking at health in a reductionist and reactive way. So we need to really focus on preventative medicine. We need to understand that there is innate healing that happens. We need to understand that our body, second to second, is having 100,000 different reactions that are happening that we have no voluntary control over, and yet we continue to live and breathe and our heart pumps blood. And so it's a beautiful, empowering, and magnificent kind of way of living life. And so I believe in the integration and meeting people where they are. And yes, internal medicine showed me that we do have different systems and organs, but at a fundamental level, these organ systems are all cells. So on a cellular level, our cells are communicating with one another. So if we have an imbalance in one system, why can't we see that it will create a ripple effect in other systems? And the skin is really a check engine light for the body. There are so many things that we are seeing as dermatologists that give us clues into people's health, right? So like,
Oh, yeah.
acanthosis and diabetes connection. And there's so much more to it than that, but it's just a magnificent window into somebody's health. And I feel very blessed as a dermatologist to be able to have that kind of view on people's health if I'm able to really be a detective.
You know, Valerie, I love this idea of the check engine because really, I feel when people come to us, people poo poo the skin to say, oh, it's not such an important organ. Of course, all of us in dermatology, people who take care of skin issues, we feel like skin is the most important. But really, what counts is our patients, right? And for our patients, their skin is really important to them. And actually, for them to see the manifestation of disease or imbalances in their health system, in their body systems, is really critical and actually will be one of the leading motivations. I think we all know that hair loss, for example, is a motivator. People who have wounds, I know taking care of people with wounds, they all of a sudden can see their diabetes, right? They have a foot ulcer and they're like, oh my gosh, why is that? And I say, well, it's because of your diabetes. And they say, they could never see high blood glucose, but they can see a hole in their foot and they know what that means. And they know that their toes are at risk. So I love this idea of check engine and really links us nicely to the holistic kind of approach. For those who listen to us, they may say, well, that's all nice and dandy, but what happens in the treatment room? Can they tell us how your practice may be different than the routine dermatology kind of visit? You know, we're all used to coming in, seeing the doctor, they kind of hear the story, take a look at the skin. How is your visit different, if at all? Maybe it's not different.
Yeah, so that's a great question, and I appreciate that. Well, I always just say to people, I'm not that special, but I really care about people. And so when I say this, I really want to say it in a humble way. So it's not that I do anything that anybody else couldn't do, but I really take the time to listen. I allow people to tell their story. And what I find so often is that's what they're craving and their ability to release and tell their story to me and feel like they're held in a safe space to do so, it allows me to understand. And I go really deep into their history from childhood, because I think that there's an ACE score. It's a adverse childhood event score. And individuals that have high adverse event scores from childhood traumas, emotional and otherwise, definitely go on to develop more autoimmune disease and other chronic illnesses. So I really dig deep. I go into their childhood and I ask about frequent infections and frequent use of certain antibiotics and pharmaceuticals otherwise. And I really try to ask about their gut health, because I tell you, most of the people that come into me with refractory acne or atopic dermatitis and psoriasis are struggling tremendously with their gut health. And when we really look at that gut microflora and what else is going on behind the scenes, and we help with that gut skin connection, I see tremendous improvement for people. So for me, what happens in my exam room is really about getting to know the person that's sitting in front of me, because I believe that the physical information that we see with the skin, or the biochemical information we see with blood work or pathology reports, that is a ultimate printout for the whole person that's beyond that. So it's the spiritual and the mental and the emotional, and that will always precede the biochemical, in my opinion. Stress and anxiety is at an all-time high I'm seeing in my practice. I don't know if you feel the same, but it
Oh,
is
yeah.
so incredibly linked. I mean, the level of stress that we see, it's definitely linked to effect in the neuroendocrine system and cytokine release and inflammation and, releasing cortisol, and all the things that cause inflammation in the body are going to ultimately affect skin health, of course. So I hope I
Right.
made myself clear about what's different. It's just that I listen to the story.
Yes. And I think we wanted to talk about some examples. For example, you mentioned the issue of the gut and its health and its relationship with the skin. And I think that probably separates you from many other dermatologists, because I believe you test the gut, right?
Yes, I do.
And so perhaps you can give us an example of kind of that scenario where you're talking about the gut health really affecting everything in the skin and beyond. Maybe there are cases where the stress and the gut composition is really kind of out of sync, leading to skin disease. What are some common condition that kind of walks through your door? I don't know if daily, but maybe weekly, or you see it frequently, that really gut testing really made the difference for you in your approach to clinical care?
Yes, absolutely. That's a great question. So I see a lot of acne,
Mm.
mostly young women in their 20s and 30s. And before I even do the stool testing, looking at the cross section of the gut, most of the women have very similar stories in terms of they all have constipation. So we have normalized, I mean, even in medical school, we were taught that it's okay to go 3 times a week. Although that may be common, it's not optimal. So we have to really look at the body in this optimal physiological form. We need to be eliminating 1 to 3 times a day, because toxins that don't leave the body will end up recirculating and affecting our skin health. I go over their drainage pathways. So I really ask them about their constipation and how often do they go. So I see that very commonly with my acne female patients, particularly. And then I do the gut testing and I see some patterns that can look like, for instance, very low commensal bacteria, the good gut bacteria. And sometimes I'll see very high bacteria that are commensals but shouldn't be high. And a lot of times that's because of certain infections that can create low stomach acid in the body, so that we are not digesting properly, that the food sits there and it really is a medium for bacterial overgrowth. I see a lot of candida and yeast overgrowth in people's gut testing. I see some markers of inflammation. I also see an enzyme, beta glucuronidase, which can be high, and it's a marker for an inability to detox properly after the phases of liver detox, phase 1 and 2. So there's so many markers, but I never let the data take over the person sitting in front of me. So the numbers mean nothing without the story that is sitting in front of me and what their journey has been. So I use the gut testing as a one piece of the very big puzzle. But yeah, I'm just seeing a lot of dysbiosis. And we all have this. We all have this hyperpermeable gut because we live in a world full of toxins, unfortunately, the food, the water, the air. And so just showing people how to develop tools to combat this is really all I want. I never want people to live in fear. I just want them to be empowered and understand that they have the ability to balance their microbiome and learn about nutrition and herbs that will calm out this dysbiosis. And so I curate very bio-individual protocols, and we check in regularly. And these are for the individuals that really want this type of care. So I meet people where they are. Not everybody's ready for this, and that's okay
Right.
too.
Oh, yeah, no, absolutely. And this is a lot of great stuff there, Valerie. I'm going to try to pick some of this because there's a lot to discuss here, obviously. But I really like your approach of listening to each patient. But let me put on the cynical hat for a second and say, well, you're going to do all this fancy testing, but doesn't all boil down to, well, just eat good nutrition, give yourself good fiber, feed that good bacteria, good microbiome, good yeast, etc. Make sure that, that allows you to kind of go frequently. Don't eat too much animal products. Make sure you have enough protein, green leafy vegetables, the usual spiel, right? Isn't that all boils down to the same thing? Or am I missing something? Where do you find that you have nuance in prescribing the nutrition based on your testing?
Yeah, no, that's an excellent question because there was a time years ago when nutrition was the forefront. In my beginnings of my own personal journey, it was. But what I'm finding now is that our soil is incredibly depleted because we're just over farming the land. And so a bowl of spinach in my grandmother's time, now I have to have maybe 15 to 20 bowls to get the same nutrient balance and dense nutrient, profile. So it definitely is a huge part of it. But what I really try to educate people on is that nutrition is one piece and one pillar. There's also, you can't out supplement the pillars of health. So you're 100% right. Nutrition is key. So that's one part of it. But there's stress management techniques, there's toxin avoidance. So I really encourage people to look at the products they're using because oftentimes, without any gut testing, I've cleared certain categories of rashes that are simply happening because ingredients and products are just not doing well with certain people. So it's about really analyzing and being that detective to kind of have a view into somebody's life. And is the product you're using on your scalp attributing to this? Can we just eliminate that first before we do any fancy testing and see if it takes you to the next level? And then we just build, we stack 1% better every day. So yes, nutrition back in the day might have been my biggest tool in my toolbox for people and for myself. But now, because of what we're up against, I truly believe that toxins are the greatest threat to our physiology. And they really know how to hide in our body. They hide in our visceral fat. And it's very hard sometimes to get these things out. So I work with certain supplements that help bind and rid the body of these toxins. And it's a really multi-pronged approach. So I also really value the data from just regular blood work. I look at general blood work through an optimal range, not just the reference range, because
Right.
now, blood work represents 95% of statistical analysis of 95% of the population. And unfortunately, statistically, 88% of our population is metabolically inflexible and unhealthy. So we can't really they're changing reference ranges in labs now to fit what's happening. And instead, they should be really kind of analyzing why this is changing. So that's part of what I do.
They
And it does,
change
yeah.
instead of educating the student, they're just changing the test, huh?
Yes, exactly. That hits the nail on the head. I hope I answered your question about nutrition.
You You definitely did. It's absolutely true. There's much more than nutrition. And I agree with you. I do feel that a lot of my patients tell me, I'm eating right. Why is this still happening? And it's true. It's much more than that. It's good sleep, stress management, is spending time with family. It's how you eat, sit down with your family members and have a communal meal, I think has a lot of value because it hits all those things, right? It reduces stress, give you good, positive kind of vibes that really improves your psyche overall. And then you probably digest the food better because digesting under stress is not really good digestion, right? Our body is not meant to that under the kind of stress response. So everything you said makes a lot of intuitive sense to me, and I think really is great. You did mention something about even before the testing, how certain products can lead to certain reactions. And, one of the more common questions that we get in clinic is how to choose wisely when you look at the skin products in front of you. And I think that that's a question that always gets me, right? Because there's so many different products on the market, so many ingredients, so many things that are in vogue for about a month and then disappear. And now with all the Instagram, TikTok, you name it, everybody comes in and what do you think about this? And what do you think about that? So how do you educate your patients about skincare products and how to choose wisely when you look at this huge array of products out there?
Yeah, it can be quite overwhelming. And by no means am I an expert on every single product. I wish that I could say I'd spend an hour in a pharmacy just going through every over the counter version of acne treatments out there. But what I find is, again, through personal experience and research, that there is a comedogenic scale for my acne patients specifically. And I find that some of the products that say they're non-comedogenic, although they're great for the average person, for my exquisitely sensitive patients, they're really not. So I've learned over time to just really research and dig deep and find lines that are really making a difference, that are affordable for some people. There are more expensive lines that I like too, but again, meeting people where they are and just shifting away and understanding. So what I tell patients is that your skin functions at a certain pH level, and we don't want to alter that pH, because at that more acidic pH, we have more ability to fight infection and preserve our barrier. So I try to educate them on the ingredients to avoid and ones to go towards more that help balance that, and to really do that with cosmetics as well. So I have like a list of pore clogging ingredients, and they can cross reference and check. And there's certain lines that I like. I'm not sure if you want me to mention them. I have no affiliation, but I definitely find that there are people that do amazingly well simply by just changing the line of products they use. There are apps like Yuka and EWG that people can use, but I find even those can be a little bit tricky for people. But it's just about avoiding certain things that our skin and our body just aren't meant to really be absorbing, and they can do much better just staying with this few things that I recommend.
Right. And, I feel more recently, at least in my practice, that patients come to me and I can tell that they probably have some kind of a contact dermatitis. Yet they
Yes.
say, we're not allergic to anything. We use the same products for such a long time. And I feel that what happens is the barriers kind of really slowly gets eroded. And now you're exposed to all these allergens and irritants, and that it's a cumulative effect, if you will. I don't know that we know exactly how to measure it, but it really certainly seemed to attack people in their 50s or 60s. And I say, you're starting to lose the vitality of the skin, as especially for females going under hormonal changes on one hand, but certainly males as well. And then all that impact from the environment, right? All these toxins. And then comes the pH game, which I think is so true. And then kind of trying to restore that acid mantle on our skin, really keeping acidic environment. And then I say, we have to just scale back. Everything you used before, I know you will probably be able to reuse it, but we need to first heal the skin to allow you to create that barrier again. So what you say makes a lot of sense, kind of putting it together. I feel like it's a very common complaint, at least in my practice. I don't know if you find the same complaints.
Yes, and the thing is that our skin is incredibly robust. There was an article written that showed the different layers. We have an ecosystem. We live in an ecosystem. Our skin is an ecosystem. So we have that microbial layer, that's the interface that our skin has with the outside world. And then there's that chemical barrier with the natural moisturizing factor. And we also have a physical barrier with the epithelial cells and the tight junctions. And then we have the immune barrier that preserves our immune health with our skin. So it's really amazing what the capabilities we have. But unfortunately, with hand washing, which is necessary and important, but the use of maybe over sanitizing our hand with hand sanitizer and the world we live in, it's just hard for our skin to keep up, and it's really never working against us. Our body's always working for us, and sometimes it just has to show us that we need to change our ways. So yeah, I think we do have such an important job as dermatologists to educate people first and foremost, so that they can start to make choices that work better for their skin, and that will ultimately help their lives in so many different ways, because we really have a responsibility to help people feel their best. And sometimes for some people, looking their best makes them feel their best. And it's not a vanity thing. It's a lot of psychosocial things that come along with dermatological conditions.
Absolutely. Well, Valerie, thank you so much. This has been such an interesting conversation, really taking through the holistic approach, some gut health and skin products, really hit all the high yield stuff. So thank you. I'm sure that your patients really find value, not only in your ability to really test and your knowledge base, but your ability to just listen. So I'm glad we listened to you. Thank you for your time.
Thank you so much. I really appreciate this. Thank you.
Folks, we'd like to invite you to check out our colleagues in the dermatology podcast family, Dermosphere.
Luke and Michelle are two board-certified dermatologists who also discuss the latest research in the world of clinical dermatology. Learn about recent drug trials, disease pathogenesis, off-label drug treatments, and more.
Come for the dermatology, stay for the dad jokes. Dermosphere has been around since 2019, and I just love seeing how they grow as part of our podcast community. Search Dermosphere wherever you find your podcasts.